is a formal council committee. The proceedings will take place live on the internet and the meeting will be recorded for future viewing. It will assist the conduct of business if participants speak when invited. And members of the public are welcome to view the proceedings, but should not make contributions at this meeting. All participants should mute their microphones and turn off their video feed when they are not speaking. Please remember to unmute your microphone and switch on your video feed when it is your turn to speak. Speak clearly and slowly into your microphone. Anyone wishing to speak should indicate using the raise your hand button on Microsoft Teams, and I will invite people to speak at the appropriate time. If you do not have the hand button, please type in your request in the chat function. I ask for everyone's patience with the use of technology, and I apologise in advance if we experience any unforeseen difficulties, which we shall try to resolve expediently. I shall now follow the items of business as set out on the agenda. Any apologies for absence?
None, Chair.
Can I just say
to report on
an apology?
Yes.
Into work.
Is that Matt?
No, Alan Hopwood. He's been called in.
Is that you, Chris?
It is, yes. Good evening. Yeah.
Who was Chris, you're breaking up. Who was giving apologies?
Councillor Hopwood. He's been called in. He's on call. He's been called into work.
Okay, thank you.
Chair, I'm also covering for Helen Ellis.
Okay, so you may be called away at some point.
No, I'm covering the meeting for Helen Ellis.
Okay, thank you, Matt. Okay.
Chair.
Yes, Anne.
Chair. Yeah, I'm here as an invitee, as chair of children's. But if it's agreeable, I will sub for Alan Hopwood.
That's absolutely fine. I think it was must have been a late call, so that we can do that, Helen, please. We can put Councillor Al Millwood in as a substitute.
Right. Okay. Cheers.
Okay, Chair.
Thank you. Thank you. We've got all the substitutes sorted. So to receive any declarations of interest under the Members' Code of Conduct. Steve, Walter.
Yes, thanks, Chair. I always make sure this is recorded, just as a member of the Council of Governors, Russell Sword. I'm the council nominee on that body. It's not a decision-making body, but I always do, you know, put my thing in.
Thank you, Steve. That's noted. And now, agenda item 4, to confirm and sign the minutes of the meetings held on the 15th of October. We'll do that one first, if you wouldn't mind. So, can I confirm and sign the minutes of that meeting, the 15th of October?
You can, Chair.
Yeah.
Thank you.
Yep.
Chair.
Yes,
Councillor Baton.
Cassie's got a hand up, Chair.
Thanks, Chair. It's and it's relating to the minutes that I've been made aware of some information in relation to the report by the ambulance service, and I'm just wondering whether do you want me to talk about it now, or do you want me to do it later in the meeting?
If it's we haven't got the ambulance service on the agenda.
No, can I do it now then?
I think it might be appropriate to do it now. If it's some information which would help the COVID response, and it's part of it.
Yeah, it wasn't available to me at the last meeting when we did have the partners around, so I wasn't aware, so I couldn't raise anything. But it's been raised as a matter of concern of getting, in times of crisis, how quickly ambulances can actually be triaged and got through the hospital with the current arrangements. So what I'm advised happens is that ambulances are backing up at the hospital, taking a long time for patients to get triaged for obvious reasons, but that then takes ambulances out of general circulation, and obviously each ambulance has to be sanitised before it can go back in. So I just wonder whether it would be pertinent, Chair, to write on behalf of this committee to the hospital, just asking what arrangements they are reviewing for during the current crisis. So we know that this happened the last time. We know it's going to happen again this time now, because people are no longer frightened to phone an ambulance for other reasons. So you've got an additional demand on the service. So I just wonder whether it would be appropriate to write on behalf of this committee asking assurances about the measures that they'll be putting in place.
Thank you, Kathy. I think it's a point well raised, to be honest. It's something that probably is not, it's not just isolated to Dudley, but on a wider issue as well. Matt Bowsher, you've got your hand up.
Thanks, Chair. I think it would probably be sensible to correspond jointly with the Dudley Group and West Midlands Ambulance Service.
Yeah, you're right there. I think it's an issue that is theirs, but it's been raised by a member of this committee. So it's appropriate we should liaise with all of the partners who are directly responsible for that. It is a point well raised. Just sitting here thinking it perhaps might raise an even bigger issue about hospital design in the future. So if A&Es aren't big enough in normal times, what happens at a pandemic is that the A&E department actually by sheer nature will spread, and we'll need that breathing room within the building. So is there anyone from the NHS or Neil, did you want to add anything to that? Neil Buxton.
Yeah, sure, Chair. I mean, I have some experience of this because I was the Black Country CCG director on call last week. And yes, there have been difficulties offloading ambulances. But I mean, to give you an example, one particular case I was involved in, the ambulance was waiting because inside the hospital, they were trying to rezone clinical areas between COVID and non-COVID occupation. And that takes some time when you're trying to sort of roll through the hospital, clean down areas, redesignate them for COVID patients or non-COVID patients to maintain the flow. So that's just an observation on my part as much as anything else. Colleagues from the trust will be able to give you a far better description of what's involved and why these issues can occur.
Thank you, Neil. That's appreciated. So, if it's okay, then with the committee, I think what we need to do is we'll liaise with the appropriate officers, the CCG, and the NHS Trust and the ambulance service, and we'll make them aware of the issue that's been raised through a member of this committee, so that we can actually see if we can highlight it so that at least it's in some documented form going forward. Is that agreed? Kathy, I'll come back to you first. Is that okay with you?
Yeah, that's absolutely fine.
Yeah.
Thank you, Chair.
Is that agreed with the committee?
Yeah.
Yeah. Okay.
Yeah.
Thank you. So I can sign off the minutes for the 15th of October. Now we move to the minutes of the 4th of November, please. Can I sign those off as a correct record?
Yes, Chair.
Yes, Chair.
Yeah.
I'll take that as yes then. Okay. I've taken it upon myself to invite our Chief Exec, Kevin O'Keefe, to this meeting. Kevin's been a good support to this committee right from the very first day. And I think it's appropriate because we're now at the last meeting of this response committee to offer Kevin the chance to give his not verdict, but some support to us going forward. So, Kevin, if you wouldn't mind, please.
Yes, thank you, Chair. First of all, I'd like to take the opportunity of congratulating the committee for being, I think, the first off the starting blocks, probably not just within the West Midlands, but probably within England. This is a very timely piece of scrutiny work and a very thorough piece of scrutiny work. Both myself and my directors and officers have put ourselves at the disposal of the committee to be as honest and frank and as forthright as we possibly can be to each of our interactions. My view is that the thoroughness of this work, obviously, it is tonight you'll be signing off the work you've done so far. But my hope would be that the committee would keep their finger on the pulse, as it were, because we are by no means out of the woods at this stage. I suspect, looking back at snapshots of time, that the piece of work that this committee has done, and I've said it previously and I'll say it again, will be a valuable piece of information and a valuable tool for scholars as they look back in the way in which the country has met the challenges by COVID. And whilst I will certainly be arranging through the comms team for appropriate press releases to be submitted to the Municipal Journal, the Local Government Chronicle, and also to the Centre for Public Scrutiny, I know are very, very interested professionally in the work that this committee has done. I'd also recommend that the findings of the committee are then submitted to a number of education institutions like the University of Wolverhampton, Aston, Birmingham, and so forth, because it's my view that more than one PhD thesis will be written, and in those circumstances the work of the committee will be enshrined not just within the borough, but will be referenced in very many scholarly works going forward. I know that was the case as far as the fallout from the Grenfell fire disaster was concerned, not just the Kensington and Chelsea, but the work done elsewhere within the country, and particularly within the West Midlands. And I'd fervently hope that would be the case as far as this report is concerned. It's a report that covers not just the work of the council, but it goes into detail with regard to our strategic partners throughout the pandemic. It is a commendable piece of work, and I'd like to thank the committee very much indeed for the skillful way in which it's been handled and the way in which it's been put together so far. Thank you, Chair.
Thank you, Kevin. Much appreciated, and thanks for your support since day one. I think we're all rather proud of the fact that we've stuck together and stuck through it, but we couldn't have done it on our own. We've been blessed with some really top quality input from our directors and all of the officers under their charge. So thanks for that, and thank you for the support, the ongoing support to the other bodies that you've just mentioned as well, to push it to them. All right. Thank you, Kevin. Now, agenda item 5 is the local and national COVID-19 developments. This is a verbal update. Is Bal here?
I am, Chair.
Hello,
My reception isn't great, so I am going to switch the camera off because I am sort of coming in and out. So hopefully you can get my update clearly. So you'll all be aware that the Dudley rates are continuing to rise. We've now got confirmed cases of 530 per 100,000 for this last 7 sort of day period up to the date of 12th of November. They're continuing to increase, and the increase we've seen has been about 200 per 100,000 cases, from 330 to 530 over the last 2 weeks. So you can see that it's quite a big jump. We had been seeing an increase of a doubling every, seems to slightly have slowed down. We do now have the second highest incident rate in the whole region, and it's amongst the top 10 boroughs nationally for the highest rates. We're slightly behind Stoke, who are the highest in the region and are currently the 8th in terms of across the country. Testing, as you'll be aware, has really been stepped up in Dudley. So some of these cases are, you know, we're identifying more cases because of increased testing. We've seen 3,109 tests per 100,000 over the last 7 days, and we've got one of the highest testing rates in the Midlands. This has increased by over 22% since the previous 7-day period, and by over 76% since the first local testing site opened. And we are seeing a very high positivity rate, so the right people are coming forward to get tested. In the last week, we've seen a greater percentage increase in the under 10s, but we're also, what is really concerning is the cases that are increasing in the 60+ group, which have doubled in the last 2 weeks. And this is where our real concerns are. This is the population group that we are now seeing are having an impact on our hospital admissions. So over the last sort of week, we've seen an increase in admissions. So we had 68 the previous week, and the last week that went up to 93. Sadly, with this data comes the news that our death rates is increasing. We've seen an average of 16 COVID-related deaths per week in the last 2 weeks, so that's over 30 in the last 2 weeks. Since the end of October, the weekly number of deaths has been doubling every 2 weeks. I've not managed to give you sort of the real detailed data that I presented at the previous scrutiny meeting. It's just on a Monday. It's really difficult to sort of catch up over the weekend. But I think what's really important to note is that there is a 2 or 3 week lag in when we're seeing the rates of infection going up and the impact it then has on the health and wider social care system. So I think sadly the situation we're at the moment is that we are likely to continue to see pressure on our hospital and social care system, and sadly this is likely to contribute to increased deaths. I'm hopeful that the lockdown, the measures will start to have an impact. What we are seeing across the whole country is almost a wave of cases. It's moving sort of from north down towards the south. And we have sort of followed, our case rates have followed the increases in the Shires, and South Staffordshire, being an immediate neighbour, has also seen a significant increase in cases. I think that's all I've got for the moment, and I'm happy to take any questions.
You're on mute.
You're on.
Councillor Chris Neal first, please.
Good evening, Belle. Sorry to bother you. I'm sorry, unfortunately. I've got a couple of questions for you. Today's figures, I think we're currently the 15th least rate of infection in the country. So it's a quick question really about the rollout.
Chris, you're breaking up. This is the chair. You're breaking up.
Sorry, I'm struggling. Can you hear me now? Is that better? Is that better now, Chair?
Yeah.
Yes, it is.
Struggling with internet today, I do apologise. Right, sorry, Val. I'll try again. Yeah, I think our current date at the moment, we're the 15th highest rate of infection in the country at the moment. So I presume we'd be quite high on the sort of outtake of the rollout of the vaccinations. That's the first question. Second question, when we do get the vaccinations, a question for sort of GPs, public health and NHS. I believe we're going to try and sort of formulate a plan to roll out the injections, the distribution, the administration, the handling of it. And the third question would be trained staff that we're going to use to administer the injections. Where are these likely to come from? Thank you.
I think Neil's probably in the best place to answer this question, because the COVID vaccination programme is being led through the NHS. Neil,
Yeah.
Could you be able to just give them a brief overview? Thank you.
Yeah, I missed the first point. You sort of cut out a bit on the first point. Was that the plan? How the plan for developing the vaccination programme?
I think it was whether would be a higher priority. Yeah. Go on.
The first priority, in effect, is sort of care workers and the over 85s. The issue that we've got is the speed with which the vaccine becomes available in sufficient quantities. So we're operating on the basis that we need to be ready to start the vaccination programme from the 1st of December. We're actively doing work at the moment in order to determine the most appropriate locations to deliver the vaccine from. There are certain sort of national criteria that we have to meet. And one of the main vehicles for delivering the vaccine is going to be through general practice, organised around our 6 primary care networks in Dudley. So we've been meeting on a daily basis since last Tuesday to work through the issues that are involved, and we're hoping that we'll have kind of nailed what we need to do in terms of locations within the next few days. In terms of workforce, main workforce will inevitably be staff from general practice, but in addition, work is taking place through organisations like NHS professionals, various agencies and so on, to source additional vaccinators. And locally, we're looking at how we can use our practice-based pharmacists to be part of that work as well. So it's difficult to give you a definitive answer on many of these issues, other than to say that we're sort of working like mad to try and get everything in place at the moment. We need to have firm plans in place, as I say, by the 1st of December. Whether we've got all the vaccine by the 1st of December in sufficient quantities is another matter. The vaccine might start to become available, after that date. There are logistical issues that we've got to address because, as you may well know, the vaccine's got to be kept at something like -70 degrees. So how we organise the cold chain, the delivery of the vaccine, where it's administered from, requires quite a lot of attention. But we are actively working on that at the moment, and it's sort of occupying most of my time right now. But we're reasonably confident that we'll be in a position to deliver the vaccine once it's available.
Does that answer your question, Chris?
Yeah, in some way, yes. I think we'll probably have to come back to it before the injections we receive them, I think, just to make sure that we've formulated the plan and it's actually going to work, yes. Thank you. Okay.
Neil, while you're on the line, just a supplementary question from me about that. Is there a possibility that you might try and invoke the support of the business community, especially regarding the cold storage aspect of things?
We don't think so. In effect, if I've understood things correctly, the vaccine's delivered in kind of refrigerated containers, and then the vaccine then sort of thaws out and it becomes available. You can use it for up to 5 days. So the key thing is, managing that. And fortunately, because we've done flu campaigns and so on, then there is experience in the system to do that. So I don't think we'll need the support of the business community in that way now.
Okay, but I know that they would be the first to offer their support if required, especially premises and transport. I know that they jump in at the chance. Yeah. All right. So the next councillor is Councillor Anne Millwood, please.
Thanks, Chair. Just a question for Bal. She may not have the answer to this, but I think in our when we had that meeting of members, was it the 30th of September, about the low break? I remember at the time that Gornal in particular was got very low figures. But in the last week or so, Gornal and the Straits in particular have gone sort of right off the Richter scale, and it's very worrying. Is there any reason for this, or is it purely because of the uptake in the testing?
Yes, Councillor Millwood, you're right. All of our wards have actually gone, have increased cases, and it's community transmission. We're just seeing rates increasing. So the testing is helping us to understand where those cases are. But I would still expect the fact that we're still not testing everyone that is positive. Not everybody is coming forward, and we've seen that in Liverpool with the mass testing. Despite the call for everyone to come forward to get tested, it's primarily been sort of, you're worried, well, those people that would just come and have a test, and not necessarily those people that are actually positive. And we do know that some people are reluctant to take up tests because they're worried about the impact it's going to have on them having to socially isolate and on continuing work. So you are correct, the rates are increasing, but they are increasing across the board in Dudley. And like I've said, it's mirroring what's happening in South Staff. So we've seen a much higher increase on the east of the borough, and also towards Stourbridge South. We're now seeing that Worcestershire rates are starting to increase. They've been sort of lower than ours, but so I think we're just going to see this cases increase for a short while, and then hopefully they'll stabilise and start to come down.
Can I just ask a supplementary?
Yes, carry on.
With regards to the testing, I think there's a lot of mixed messaging coming out on this, because people are being advised to go and be tested, but if you try and get a test, they tell you that you can only have a test if you've got symptoms. So what are people supposed to be doing when they ring me and they say, well, have I got to go for a test? But the regulations, the government guidelines are, you go for a test only if you're showing symptoms. So do you have to go on the website and tell fibs to get a test? This is a big issue for me at the moment.
Yeah, so our message is that the testing sites that we've got set up in Dudley are for people that are symptomatic. So it's only if you have the symptoms of COVID that you get your test. We know that some people have very sort of cold-like symptoms. So we are, if they are being encouraged to go because they're advised, maybe they're part of related to an outbreak or situation, there is a box, I think, that you can tick to say that the council or I think public health have advised you to go for that test. But ultimately, and that's why our positivity is high, because the people that are going for testing are being picked up, which reflects that positivity rate.
Right, that's great. Thank you very much. That's clear something.
Thank you. I'll now have three councillors that want to ask questions, Val. Councillor Elaine Taylor first, and then Kathy Baton, and so Elaine Taylor.
About this is for you, dear. Going forward and looking at the figures that you've given us, and the figures are still going up. At the end of this current lockdown, what tier do you foresee that we'll come out of it in? Will we still be in tier 2, or do you think that we'll actually be in tier 3 by that point?
Councillor, one is a difficult one to answer, because some of that the situation around the tiers may be determined nationally. I can't see us coming out of this being less than a tier 2, because we would only just got to a rate where we'd moved tiers just before the lockdown. But I really don't, there are conversations taking place regionally and nationally, so I'm not in a position to sort of say which tier we will be. But I think our messaging to our population is that we really need people to adhere to the guidance and take advantage of this lockdown, because if we don't bring the rate down, we are really high. It's unlikely that we're going, people are going to be able to have loosening of restrictions if our rates continue to increase. So I think, I can't answer what tier we'll be in, but I think, the rate where our rates are at the moment, there is all the evidence suggests, and what we know from the first pandemic, is that it takes a long time for rates to come down. So the higher they are, the longer it will take for us to reduce them.
Thank you, Bal, but that has a big impact on businesses moving forward to the 2nd of December, does it not? Yes.
Yeah, it does. Thank you, Elaine. Kathy Baton now, please.
Thanks, Chair. Couple of questions for Bal. We had a sudden rapid rise, as we've said, in positive cases. Does that suggest that there was mass underreporting here in the past? You know, do we solely attribute the rise in positive cases to the increase in Pillar 2 testing? So that's the first part. The second is, we were Tier 1 authority for a significant amount of time, and I know we kind of, as the figures were rising, I think some of us expected us to go into Tier 2 and we stayed at Tier 1. Actually, would we have benefited by going into Tier 2 earlier and having additional capacity and testing resources made available to us? And my third question is, we touched on this at, I can't remember if it was the last committee or the committee before that, where you'd said that that Public Health had put a bid into government for a test and drop service to test vulnerable communities, alongside the Birmingham model, and Dudley were refused that to work with a community pharmacy to deliver it. Has that been applied for again? And is there any chance that we could be successful for that particular method of testing? Thank you.
Councillor Baton. So yes, the first one in regards to the mass rise, it's really difficult to ascertain where that rise has come from. It is primarily the it is transmission, and we do understand that people have been reluctant to get tested, and it may be as a result of the fact that we did have challenges with testing capacity. It's really difficult to relate it directly to that, but you're aware that there was challenges at the start around September, and I think I do feel that a lot of the focus of testing and interventions did sort of focus on areas in the north and where there were much higher rates. So I think every time we got to a position where we were on a sort of about to move on to the government watch list, everybody else's rates around us had risen to the extent that we were no longer seen to be at that sort of higher alert level. So I think there's been, there still needs to be some understanding as to the areas like the Shires and like Dudley, where there was probably not the same level of testing and the same level of sort of investment in the infrastructure that might have resulted in a delay in us capturing community sort of cases. So that's the situation there. But we are seeing the wave. We are seeing it moving from areas where there were really high rates to now areas that historically in sort of September, early October had very, very low cases. In terms of Tier 2, I think from a public health perspective, I think any form of early sort of intervention would have benefited a reduction in rising cases. However, I think the situation has been very complex, and the decisions that have been made around the tiers have also involved the economic impact and the social impact on communities and society. So I think the decision to move tiers has been far more complex than just the rates in each local area. And then I think in terms of the bid for the test and drop, you are right, again, because Dudley's rates were low. When we did put ourselves forward for any pilots, we were turned down because focus was on areas with higher rates. The focus now is moving towards the lateral flow test. So I think we're going to see quite a shift in the way that the testing programme is going to change. And those lateral flow tests cannot be undertaken directly by individuals. They do, however, turn the result around in 30 minutes. So you'll be aware that Dudley is one of the areas that put ourselves forward for sort of starting with the tests. We were going to try and use the pharmacy model, and this is what we'd proposed earlier in the year. But I think the challenge with the pharmacy model is the cost implications. And initially we were told that the testing required clinical leads, but more recently we've been told that we can probably deliver these with very well trained staff. So we may probably be able to deliver it at a much more cost-effective sort of method, rather than purely focusing on pharmacists, although we're not counting them out. So I think, you know, I think that whole sort of opportunities around testing are changing, and we will do whatever we can to make sure we're focusing and targeting them at where we're going to have the biggest impact. And I just want to say that this, the lateral tests are not reflecting Liverpool's mass testing. The lateral test approach now really is to target, and our approach in Dudley is going to be initially focusing on key workers, so that they can be tested and results can be turned around very quickly, and therefore they're not having an impact on the workforce capacity that we're seeing across the system. And the NHS themselves will be receiving these tests directly as well. So hopefully that answers your questions, Councillor Baton.
Could I just ask a couple of quick supplementaries, please, Chair?
Yeah, carry on, please, Cathy.
Just going back to the tier, the decision-making systems around the tiering structures. Is that decision made locally or nationally, or is it made jointly together to move in or out of tiers? And just picking up on your final point around the lateral testing, do we have assurances that that will not be outsourced to the likes of Serco or Deloitte to deliver on behalf of Dudley residents, please?
Okay, so in and out of tiers was both locally and nationally. It required discussions at both levels, and then with regards to the lateral testing, we have been assured that those tests are coming directly to DPHs. So we're now utilising the resource that's been given to us to make sure that we're targeting it directly at the populations we need to. So we're definitely not going to be sourcing this to Serco or Deloitte or any of the current testing agencies. However, there may be, again, they may be utilising those technologies as part of their testing programme going forward.
Thanks, Chair. Thanks, Val.
Okay, Cathy. Councillor Peter Lee now, please.
Thanks, Chair. Okay, yeah. My question is really, do we have enough cold storage for the vaccine? I mean, it's going to be quite a large volume. Where would that be stored? Val, perhaps?
I think this one's for Neil again.
Yeah, I think it'll arrive in suitable storage containers, and then subsequently it can be stored in the normal sort of fridges that are available in general practice. So it doesn't need ongoing storage in you know, at really low temperatures, but it arrives in packs in a container that stores it at the appropriate temperature. Then it can be transferred into a usual sort of fridge that practices use for storing flu vaccines and so on. So that isn't the problem. But the main issue is the site's been available and open to receive vaccines at various times that, you know, may not necessarily be predictable. It's a similar situation that we had during the swine flu pandemic. When was that? 2009, 2010, when we didn't quite know when we're going to be receiving the antivirals, and they could arrive at any time, and we just had to be in a position to receive them and be able to move them through the supply chain. But storage at low temperatures shouldn't be a difficulty for us.
Okay, thank you.
Thank you, Neil. Thank you, Peter. Thank you, Val.
Thank you,
Are
Chair.
any other Thank you, Peter. Do any of the councillors wish to add any more questions, comments? Any more of our officers or partners wish to add anything to this part of the proceedings? No? Okay. Thank you very much, Val. Thanks for that update. It is a worry. I think all we need to make sure is that we keep pushing the message out that that this virus is no more than a hitchhiker, to be quite honest. It just sits there and just waits for someone to take it somewhere, and we're the people that are taking it somewhere. So as soon as we can all cotton onto that, the better, really. Thanks very much, Val. Moving on to agenda item 6 now, the scrutiny review of the council partners' response to the COVID-19 pandemic. And this is a consideration of our draft report and recommendations, pages 1 to 3. Before that, there's a question been raised on the whole report by one of the members, and I'm going to ask Steve Griffiths now just to outline how someone who reads our final report can access the whole report, including all the back papers to it, because when you look at the documentation, this is it. It's 5 centimeters thick, and we couldn't put that out to every member of the council, but people will want to access that. So, Steve, can I bring you in, please, to talk about these links that you've formulated?
Yes, thank you, Chair, and I do thank you for that bit of feedback there. Obviously, the report was put together very quickly to reflect on your deliberations over the last 4 meetings and take on board the point that what you don't want is for people to have to hunt around the internet if they want to refer to one of the background reports or any of the information that you've received at the last 4 meetings. So Helen in my team this afternoon has very helpfully inserted hyperlinks direct to documents and reports that have gone before. So that makes it much easier for the person trying to access that information to get to it. But as you rightly say, Chair, I think to append all the previous reports would have been a huge printing job. So hopefully in time for the full council meeting in 2 weeks' time, the report will be fully hyperlinked and easier to access that information.
Thank you, Steve. It is a massive task. I appreciate that, and it's sort of a moving task as we go along as well. So if we can come now to the report, please. So that's pages 1 to 3. Am I going to present this, Steve, or you, or Mo, or?
Chair, I can briefly say that hopefully the report needs very little introduction from officers this evening. It is a report that is reflecting on the outcomes and the recommendations and all the information that you've considered over meetings since the 10th of June, and it encapsulates the subsequent meetings after that. The report has highlighted all the outcomes and the recommendations that we would ask you to confirm tonight and forward to the Cabinet meeting, which is next Monday night. That's the 23rd of November. And following that, the full council following Monday night on the 30th of November. So it's open to members of the committee for any comments that they want to make on the draft report.
Thank you, Chair. Thank you. See, you've been promoted already. Thank you, Steve. If I just run through then on the pages, if we go to page 31, that's agenda item 25. That's the local update. We've had that, and this was from the 16th. So our main report, hang on, let me just get the main report. I've got that many reports in front of me. The report will start off by a preface from myself, which you will have read, and then a note about COVID-19 pandemic from Councillor Neil and myself, and then we move on to the outcomes and recommendations. Can we look at paragraph 17 first, please? And this is the COVID-19 pandemic outcomes and recommendations. Are there any comments to be made on that recommendation? Hang on. Councillor Jackie Cowell, please.
Yeah, thanks, Chair. This is one of a number of similar ones, really, where it seems to me that they're more like internal sort of references to do with things, you know, between members of the committee, and not necessarily a wider recommendation that needs to go anywhere else. That was my view. I wondered whether some of those things necessarily need to be included.
Yeah.
Thank you, Jackie. Can I just say, just harking back to what Steve has just said, there will be hyperlinks to each individual section of this report from today onwards. So that if anyone wants to look at a particular part of the report, there'll be a hyperlink taking them to that report. It isn't physically possible to print this whole report. As I say, it's hundreds of pages, and it wouldn't be viable to do that. So if we can please look at the report and then imagine you've got a hyperlink at this point to it, which you could refer to in relation to the outcomes and recommendations. Does that make sense, Jackie?
Yeah, I see where you're coming from. I'm just, like I said, I'm not sure necessarily we need all of these actually in. I think there's some stuff that needs to go in, but some of the recommendations possibly relating to internal stuff, I'm just not sure that needs to, because the link would be there anyway. That's the point. You'd have it in the other document, wouldn't you? Well, I don't know. It's just a thought.
Yes, but it's there has to be some recommendations. It's council practice that we put outcomes and recommendations at the end of documentation. So it's just following it. It's following a norm, really, Jackie.
I think it's more because we're doing a report. Well, that's different from minutes, isn't it? We do it for the minutes, but we don't necessarily need it for the actual reports. Not all of them.
I think what we need to bear in mind that this is a report like no other. So we're in virgin territory here. So please bear with us. Okay, does that make sense?
Yes, Chair, if I might just say, Kevin has suggested that it might be useful for me to put the report up on screen so you can go through the recommendations. Also, in response to Councillor Cowell's comments, which are well made, we've included everything for the sake of completeness, really, is the short answer there, just so nobody can say we've missed anything out or, you know, something that was in the minutes that's not in the final report. So I will share the screen now, if that's all right with you.
Yes, if you would, please, Steve. It's easier for me at my end as well.
Okay.
Councillor Cowell, is that okay with you?
Yeah, I mean that's fine. Yeah.
Okay, thanks. Councillor Kathy Bates. Now, is that agreed then? That's the first recommendation. Sorry. Coming back to recommend paragraph 17 is the first one, Steve.
Okay.
Bear with us, folks. It's all virgin territory. Now that's the outcome and the recommendation to the COVID-19 pandemic. That really is just the preamble to our documentation. So is that agreed?
Yeah.
Yeah. Councillor Kathy Baden, I've got you with a hand up.
Yeah, I think, Chair, and it might assist the comments that Jackie has made. Could they be split? So when they're presented in the box, I do think we should perhaps split them between local recommendations, national recommendations and regional ones. So they could be, you know, headed local recommendations, and that way I think it becomes clearer who we're talking to and where the recommendation sits. I think it also means that we won't lose any of those recommendations. They won't kind of disappear into the rest of the detail that we've got.
I think you're right, Kathy, and it's a point I hadn't picked up, but it's something,
just a presentation issue.
Yeah, it's something that might help. It might help if this document goes to other places.
Yeah,
where people will be able to pick up at a regional or national level.
Yeah.
So, Steve, could that be done, please?
Yeah, I'll add local recommendation into 17, Chair, yes.
Okay, thank you. Moving on then is the next presentation. This is paragraph 18. Presentation by the Black Country and West Birmingham Clinical Commissioning Group. And that report takes us through to
That one's for information, Chair, so there's no
oh,
recommendation.
that's it. I was looking for a recommendation and that was information. Right. Thank you, Neil. You can relax now, Neil. No, nothing to say on that now. So the meeting on the meeting of the Scrutiny Committee of the 3rd of September.
27th of July, Chair, we've got.
Yes, got it, missed it. 27th of July.
Yeah.
Comments by the Chief Executive the first, and then Council and Partners' response to COVID-19. And those recommendations are paragraph 44. Any questions, comments or points to raise on that, please, members? No? Can we take that as a agreed then?
Right.
Yeah, with Kathy's point regarding
Yeah.
That's the local.
Yeah. Yeah. Okay. Next one is the meeting of the Scrutiny Committee on the 3rd of September. And those recommendations are paragraph 55. Any comments or points to raise on that, please, members? We'll take that as accepted then. So, same provision there, please, Steve.
Yeah, that's a local one as well, Chair.
Okay. Paragraph 56, procurement of PPE. And that recommendation is a large one. Paragraph 68. Any comments or points to raise on that, please, members? Okay, you'll recall that we sent a letter to the Secretary of State for Housing, Communities and Local Government on the 11th of September, all about PPE. A letter that I sent to him. You've had a response, all members have had a response of sorts. It doesn't tell you a great deal, the response, it just tells us what we already knew, but it's signed by a civil servant probably. So is everybody okay that we've sent that letter, we've had a response, at least we've had a response, which is a bit of a bonus. All right. Okay, so we'll put that in with the documentation as well, please, Steve.
Okay, that is hyperlinked, Chair. So.
Thank you very much. The next one is communications. And that recommendation is 79, paragraph 79. It's a pretty simple one.
It's a local one, Chair.
Councillor Jackie Kell.
Yeah, thanks, Chair. Again, I might be being a bit of a pain, but I don't know whether we need to look at some of the text as well, because if you go back to the second bullet point in under paragraph 77, it talks about your borough, your home. I just wondered whether that needs just a little bit of explanation of what it is, just perhaps an extra sentence or something to make it make sense to an external audience. Don't know whether that would be picked up in the linked documents. Not sure.
Yeah, just an explanation as to what your borough, your home is.
Yeah, just a brief sentence. Just
we can do that. We can do that.
Yeah, I mean,
okay, Steve.
I mean, that's a very good point. Obviously, we have to, as Councillor Carroll is doing, read this as though we were the man in the Clapham omnibus in, Huddersfield or Surrey or somewhere, who wouldn't instinctively know precisely what that meant. That's a very good point. Thank you, Councillor.
Okay, thank you. You can do that, please, Steve.
You can do.
And to accept the recommendation on paragraph 79, that agreed?
Yes.
Yeah.
All right. The next one is the meeting of the Scrutiny Committee on the 15th of October. Paragraph 80, adult safeguarding and deprivation of liberty. That's dolls. I haven't got it, by the way. And that recommendation is there at the end of paragraph 84. Any questions or points on that? No, I will accept that then. Thank you. The next one, again, is communications and public affairs and public realm. There were verbal updates, and the recommendation there is in paragraph 90.
Yep.
Is that agreed?
Yeah.
Yes, Chair.
There's a hand up, Chair.
Hang on, there's a hand. It's I guess who? It's Councillor Jackie Carroll.
Yeah, sorry, it's another one of these actually. Paragraph, just the last bullet point in paragraph 89. Again, there's a reference to Kingdom Security, which seems a bit out of place to somebody who doesn't know what it is. It's another one where perhaps.
Okay. Yeah. Well said. Yeah, well pointed out again, Jackie, and thank you very much. Kathy.
Sorry to be a pain.
Kathy Baton, you've put something in the chat box.
Yeah, yes, Chair.
Do you want to elaborate on that, or is it a suggestion that we could build on?
It's just a suggestion that we, following on from the verbal report Val gave, and the response to the question I raised about the tiering system, and clearly, that's not going to be, Dudley aren't going to be the only borough that's relevant to. So, I mean, if you want to finish off the report that you're doing now, and then we can think about whether or not a national recommendation is worthy to go forward at the end on Val's report.
Okay, all right. Well, we'll come back to that then.
Yeah.
Right. Thanks for raising that. Paragraph 91 then, housing and community services. And that is recommendation on 93. Of course, you've got to look at the hyperlink for all of these, and you've got to look at the documentation that was presented in the report on the particular days itself. Is that agreed? Yeah. Paragraph 94, public health and wellbeing, COVID-19 outbreak, control plan and local government's arrangements. And that recommendation is paragraph 99. No questions or queries. Is that agreed? Oh, hang on. Councillor Carroll? Yes.
Sorry to be a pain, but again, paragraph 96 refers to Saltwell's food bank provision. Again, I just wondered whether it could be rephrased, something along the line, the fact that it's a local authority provision, because that wouldn't necessarily be obvious to anybody else.
Thank you, Jackie. Another point well made. It's a good job you can read these.
It is. You need to get out more.
Are you in lockdown by any chance?
You're brilliant, Jackie. Well done.
Oh dear. Now Jackie's shielding, so she got all the time in the world. So
she's very good.
Councillor Matt, did you want to come in?
Just for the minutes, it's not an official recommendation of this committee that anybody needs to get out more at the moment, Chair.
I'm only playing.
Yeah, well said. Or else. All right. So that one's agreed then. And we now come to the external partner responses to COVID-19, Black Country and West Birmingham CCGs, and that recommendation is 106. Any questions, queries or points to be raised on that? Now, Neil, did you want to say anything on that recommendation or?
No, Chair, that's absolutely fine.
It's the truth. Thank you very much. All right. The next one is West Midlands Police, and that recommendation is 114. Yeah, is that agreed? No hands up. Thank you. And the next one is the West Midlands Ambulance Service, and their recommendation is 120. Any points to be raised on that? We did have the point raised by Kathy earlier on, which I think in the interest of fullness, I think we need to write a letter to the partners and the ambulance service to raise the point raised by Kathy to her by members of the community, and we'll put that into the report at some point. Is that okay, Steve? Is that relevant?
Yeah, I think we can put that in at the end, just to finish off. Say we've had this meeting tonight, and that's a additional comment. So yeah.
Thank you. Health Watch, the community response, and that recommendation is paragraph 125. Councillor Cowell again, please.
Yeah, paragraph 123 to the last sentence refers to access and pleased to meet you, and then paragraph 124 talks about Queen's Cross, and again I just think they need put into some sort of context.
Yeah. Okay, Jackie. Points well made again. Thank you very much. So is 125 agreed? Yeah. Jane, did you want to?
There's a hand up, Chair.
Kathy Baton, please.
Sorry, I was ahead of you, Chair. I was waiting to come in on 126, so just ignore.
I'm not going that quick, am I? Right. Jane, did you want to come in on the Health Watch one, as you're a member of this committee and on Health Watch?
Yeah, so I'd like to kind of thank members as well for us to be given the opportunity to kind of feedback. And I suppose just to comment about, obviously we're, or I'm here as a member of this committee and kind of the only person in theory that's not an elected councillor. So it's not that I'm sat here and I'm kind of in silence. I'm looking to get assurance, I suppose, from all partners and all part of the local authority about what has our support been provided to the community with regards to COVID. So I think from my perspective, that's what I'm here to seek assurance. And I think like Kevin said at the very start about where this report will go, and also for us to seek assurance as time goes on about the impact of COVID on our communities is really, really important. But throughout this process, I have actually got assurance of all of the work that all partners have been done to support communities with this pandemic. So I'd like to thank everybody for that.
Thank you, Jane. That's reassuring for every member of the council. Because we're all in this together, aren't we?
Absolutely.
Thank you very much. Thanks for those comments. DCVS, oh, you might be in again here, Jane, as well. So, and that recommendation is paragraph 131.
Chair, can I come in on that? I'd talked about needing to support or to make recommendations around that. Now, at the last meeting, I'm just looking, sorry, I'm shuffling papers. I'm just trying to find when at the last meeting we had an assurance from Ian Newman, and I'm just checking because I haven't is it in the minutes that he gave a commitment to reviewing, making some money available? Yes, he has. So it's in the minutes of the last meeting. So maybe we could, the formal recommendation could be linked to that minute.
And that was that the 15th of October or the 4th of?
It's the 4th of November. It's page 40, it's item 41, the financial impact of COVID. And it says the voluntary sector organisations had supported local authority services throughout the crisis. The Director of Finance agreed to explore options to support voluntary sector organisations from unring-fenced additional COVID support money that had now been granted. I think it probably needs to say voluntary sector organisations for unring-fenced money so that they actually get it. So I think we could link that. We could link the recommendation to that minute.
Yeah, I think that's a point well made. That's the top bullet point on page HAS 51.
Yeah.
51, Steve.
Yeah. Okay.
So could that be a recommendation 3 or not?
I think it can go. I think it can go into number 2. Would be my view.
Yes, like an extension of paragraph recommendation 2, Steve.
Yeah.
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 Okay.
We can link it to the following.
There's no numbers then, is there?
Yeah. Okay.
Okay. Lovely. Thank you.
Mr. Chairman, that's referred to paragraph 143 as well. When we come on to the Director of Finance's presentation.
Okay. Thank you, Mo. I'll have a
Fourth bullet point, paragraph 143.
Okay.
Yeah.
Right. So do we accept that recommendation 131 with that extended recommendation, or it will be covered, as Mo says, in a later document as well. So, but we'll top and tail it if that's okay with the members. We'll make doubly sure it's in, because it is important we actually do everything we can to support DCVS.
Yeah.
Are members okay with that?
Mm-hmm.
I'll take that as a yes. Okay. Meeting of the Scrutiny Committee on the 4th of November. National restrictions from the 5th of November. And the recommendation is on paragraph 138. And that's noted. No names. No one wants to speak. The financial impact, that's on paragraph 139. And the recommendation is paragraph 145. And the fourth, which bullet point? Oh, the top bullet point on the first. No, it's the fourth bullet point on paragraph 143. Is exactly the same paragraph as we've just referred to.
Yeah.
As long as we've got it doubly done in. Is that okay with everybody? Mo, is that okay with you?
Yes, it is, Mr. Chairman.
Thank you. Steve, you okay with that?
Yeah, perfect.
So the recommendation is on paragraph 145.
Yeah.
Thank you, members. The next one is a really important one. They're all important, but this is especially important. Children's Services response to COVID-19.
Mm-hmm.
Those several recommendations are in paragraph 157. Any comments or points to make on that, please, members? No, all agreed?
Yeah.
Aye. The next one is the impact of COVID-19 on business and employment and skills, which is going to be a growing issue, I've no doubt, over the next 12 months at least. And those recommendations are on paragraph 160. Those agreed? Any points to be made, members? Okay, all partners or officers, please chip in if you want. It's an open house, this is. Okay, thank you very much. COVID-19 impact on specific communities. And that recommendation is paragraph 167. Any comments or points to make on that? No. Thank you very much.
Chair.
Yes, Elaine Taylor.
Chair, in view of so many schools having been put into lockdown because for whatever reason, whether it's staff or pupils, is there a provision there? Have we covered where there's a provision for the free school meals and assistance for our children that will be needing this service?
Can I just put in there, Chair?
Sorry?
Yeah, that has been put in place.
Can I hang on?
Who's answered that?
Councillor Peterlee, did you want to say something?
Sorry, I'm butting in, but yeah, to cut a long story short, that has been put in place.
Right. Okay.
And for us with foster children, we have 2 free school mealers here, and that will start on this Wednesday and go on for the continuation of the lockdown.
Okay. I'm going to ask Matt Boucher to come in at some point, but Councillor Anne Millwood next, please.
Yes, Chair, thank you very much. This is quite a contentious issue, and it's something that I fully support within the recommendations, the bullet point 2. Just for a little bit of a background, there's a school that we have that last week had to shut down 1 year group. It's in a very deprived area, and over 50% of the children qualify for free school meals. And the school staff were scratching about and ringing round the parents to say, we've got your meals here. Not one parent wanted to come in for the meals, not one. And it just shows that, yes, it's an issue that we all care about, but these parents were not prepared to come to the school and fetch the school meal, the pre-packed grab bag for the child, saying, no, leave it, we're all right. So I just thought to throw that one into the mix. It's not everybody who is taking this up, even though they're entitled to it. And it's not because of pride, it's because they can't be bothered to come to the school to fetch them. I thought I'd just put that one in there.
Okay.
Can I come back in, Chair, then, on that? Because I asked the question to start with. Yeah, perhaps it's not that they can't be bothered. Perhaps they may not feel safe. So is there another way that we can look at making sure that these children get the support that they need?
Well, we did go round in the very beginning through you, Chair, and actually deliver them. But when they live in the next street to the school, come on. I don't think it is a matter of being scared.
Okay, you know. Folks, can we, because we're just getting into a general conversation here.
Yeah.
I'm going to ask Matt Boucher to come in now. There's a couple of other councillors wish to say, but Matt, do you want to come in, please? And if there's any clarity to be had there.
Yeah, thank you, Chair. So what I'll do, Helen Ellis tomorrow morning, we will get a brief statement round to committee summarising exactly what the offer is during the lockdown period. And also I'll ask Helen if we can collate some data on what the take-up looks like, because that will answer the points that have just been made. in terms of the number of children in the borough that are benefiting from the offer or not, as the case may be. And given time, I'll get that round to the committee in writing before the next meeting, Chair.
Brill.
Thank you very much. All right. Thank you, Anne. Anne, you're frozen. Your
Oh,
hand's
sorry.
You're lying, you're frozen, your hand's still up as well. Okay, Councillor
Sorry,
Cathy Baton.
Chair.
Cathy Baton, please.
Thanks, Chair. I mean, I think this particular recommendation is, if we're talking about the voucher scheme, the accessibility to the voucher scheme, and the voucher scheme is there for anybody who's entitled to free school meals who chooses to take it up. It's, you know, we shouldn't. I don't think, you know, I think we should need to be doing the grab bags that we were having to do in the early stages, because the voucher system should now be up and running. You know, it's not a particular, it helps, it absolutely does help. And I have had a lot of conversations, certainly with the Dudley Central Cluster Connect group, when we're talking about what does poverty look like in Dudley, what is the extent of poverty in Dudley, and I don't think any of us at this stage have got a real understanding and handle on that. And we know that it's going to change as job losses become more and more prevalent in the borough. We know that level of poverty will change. So I think it's about keeping that in for whilst we have the restrictions, and that accessibility. If people take it up, it's there for them if they need it. And if they don't take it up, then there's no wastage in that situation, because the vouchers aren't paid for unless somebody actually exchanges them.
Okay.
Yeah, very good.
Thank you very much. Councillor Peter Lee.
Thanks, Chair. I think the reason that the voucher scheme was sort of knocked on the head was it was getting abused. Parents were using it to buy cigarettes and such other like things, and not spending the money on the children the vouchers were intended for. But the school meals are being dished out from this Wednesday. I think the kids have had to starve today and tomorrow. I don't know what's happened there, but they're being dished out from Wednesday. We've been informed that by one of the schools that's actually closed down, which is Russell's Hall Primary. So we can't go into the school, but we can collect the free school meals from a van at a certain time outside the school. I mean, you're damned if you do, you're damned if you don't. The fact is, the offer's there. If people want to go and collect, they can. If they don't, well, there you go. What can you do? You can't do it. It's too vast. It's just out the question. Thanks, Chair.
Thank you very much. I think we'll leave it as it is then, this recommendation.
Yeah.
As far as school meals are concerned, I think we need to be absolutely sure that the vouchers are used only for the purpose that they were intended. And I do suspect that that a lot of the abuse allegations may be ill-founded and hearsay in a lot of cases. But once something starts, it just grows legs. I know that. So, but thank you very much for your input anyway. So that agreement 167 is agreed.
Yeah.
The next one is changes in work practices and new technology. This was an important one that came to us, and the outcome is on page 1, paragraph 173. Is that agreed? That was a good one to have in, I think. Is that agreed? Thank you.
Yeah.
And now Steve Griffiths will tell us, of course, that this is the most important one left till last. Democratic services during the current COVID-19 pandemic, and that recommendation is on paragraph 178.
Yeah.
Okay, so that's agreed. And the communications update, which we have at every meeting, because it was the golden thread running through everything, that finishes the report off. Our members agreed that we've gone through the report and we are content with the report as it sits to take to Cabinet next Monday. And then if that's goes through that process, which I expect it to, and then to go to full council the following Monday. Is everyone agreed with that?
Yeah.
Yes,
Yeah.
Lovely. Thank you very much. It's all coming to a close. Right now, we've taken a few months and a considerable amount of time to do all of the meetings and reports that we've gone through, and it's down to me really to say a massive thank you to every single one of you for being a part of what I think has probably been the most comprehensive scrutiny process this council's ever gone through, and is ever likely to go through in the foreseeable future. But it doesn't finish here, because COVID is going to still be with us when this report is published in 2 weeks' time. And I suspect that COVID will be on our lips and on our agendas for at least the next 12 months and maybe even longer. So this committee, having got the remit to do it in the first place, I would suggest is the place for it to stay and the place for it to be on the paperwork for the foreseeable future. We couldn't have got where we've got without the brilliant work of our officers. I'm going to single out Val Core has been an absolute star.
Yeah.
Where are you, Val? When you consider that Val was thrust into the position and had to hit the ground running, so to speak, she has been an absolute star on all of this, because her professionalism has absolutely shone through during this COVID pandemic. And I know we're all, as local authority councillors, we know that, but I do hope and would love to see that the general public get to know that at some point in the future. Matt Boucher has been equally a star, because Matt is the voice of reason. Matt is the bloke who if you want a steadying hand on anything, he's your man. So Matt, thank you very much for all your support and guidance over the past few months. I couldn't leave this part of the meeting without saying a massive thank you to Steve Griffiths and Helen Shepherd, who have absolutely pulled everything together for us. I know we jokingly said the most important document was the last. Actually, without Steve and Helen's professionalism and dedication, none of this could have come about, because we'd have been floundering, wondering what to do. So thank you, Steve, and thank you, Helen. Your work is brilliant, and we thank you very much for it.
Thank you, Chair.
Right. Now, are there any other members who wish to pass comment on the document, the scrutiny review document that we've just gone through? I've got Councillor Peter Miller, and then Councillor Anne Millward, and then that's it. Peter Miller first, please.
Yeah, thank you, Chairman. First of all, a lot of what I was going to say you've just said. I do think it's important we keep on with this. We're not through it yet. How far we're through it, we don't know. But I think we've got to keep checking it, watching it, scrutinising it, make sure that we're still doing everything right, which the officers have been absolutely fantastic with, and the leading councillors. And just keep on top, keep checking, and I know it's always said with councils to learn, and I think that's one of the main things.
Thank you, Peter. Councillor Anne Millward, please.
Thank you, Chair. Well, as only an invitee to this committee, as Chair of Children's Scrutiny Committee, can I say how impressed I am, Dave, at you and the committee's work on this report. You know, it's something that's a beacon going forward. I'm particularly pleased, you know, that you've looked at children's services as well within this report, and I'd like to pay tribute to Helen Ellis and Andrea Stone and all the guys in children's services who've worked so well. And it's just wonderful to see cross-party working on this report and everything we do. And going forward, I'd like to think that, yeah, we can include children's services as well within this report, because that, you know, that to me is very, very important. But, you know, it really is a beacon, and well done to you all. And it's something for all scrutiny committees in future to look at. So thank you very much indeed, Dave.
Thank you, Anne. Councillor Kathy Baton, please.
Thanks, Chair. Yeah, I mean, it's been a long and a very intense piece of work to undertake. I think the important thing for the next piece of work that we consider around COVID, and I think you're right that it would be beneficial for the response to remain within this group so that you keep that consistency. But I think it's really important that we consider what difference our recommendations have made after we kind of, you know, into the new year and through the next little bit. But also, I think it might be an idea to consider doing some, rather than how we've done every directorate for this piece of work, to actually look at perhaps 2 or 3 really big ticket items about recovery, about impact of the whole, you know, of phase 1 and phase 2. So if you thought you were going to escape a lot after tonight and not still be fair and not still be doing this kind of work, I'm sorry, but we've got loads more to do.
Yeah.
Thank you, Kathy. Do any of our senior officers wish to say anything? Because we've dragged you along kicking and screaming to this to give reports to us, and we are so grateful for your honesty and forthright reports you've given to us. There is no escape from this, as Kathy said. It's one of those things that we're going to be talking about for at least the next 12 months, and of course the recovery period is crucial after that, because we're going to be in a really poor position as a country when this is all finished. So anybody else want to chat?
Yes, Chair, through you, I think it's essential. As I mentioned in my opening remarks, that this is a piece of work which is not time limited or time constrained. It's evolutionary. So this is the first chapter in what's likely to be 2 or 3 or even 4 chapters of work, as Councillor Baton has mentioned, going forward. So I don't think, Chair, by any stretch of the imagination, your work is anywhere near over. But I do welcome the suggestion that some deep dives would be used around more pertinent areas as they evolve. And another conversation I certainly had with Paul Moback has been about our preparedness as an organisation and as a borough for the second wave, interpreting and learning the lessons from the first wave, which I think is another valuable piece of work which could be implemented. And the third item, of course, as Councillor Baton has mentioned, is that you're making recommendations. These aren't recommendations that will go sit on a shelf somewhere in order to gather dust. There will need to be an action plan which officers will work up and interpret the recommendations and bring back to you in due course how those recommendations have been implemented, and in I suppose not just implemented, but in ways in which they have improved service delivery or improved outcomes.
Thank you, Kevin. Matt Bowsher.
Yeah, thank you, Chair. I'd like to pay specific thanks to yourself and Councillor Neil for all the work you've done, coordinating the agenda, challenging the content, and giving this coherence. And secondly, the wider committee, because not only have you been saturated in a huge amount of technical information, often with fairly limited notice, you've also had the very difficult job of scrutinising something that nobody's ever been through before. So it's been very, very different to the traditional committee, where you've got a clear sense of what good looks like. There's lots of evidence you can use from elsewhere to form your conclusions. And you've been very flexible as a group, but you've also been very critical in your thinking, and the questions you've asked will help us improve as we go through the pandemic. So thank you to everybody involved.
Thank you, Matt. Neil, I'm going to ask you if you want to say a few words, please, because you're one of our important NHS colleagues, and I know that the NHS bought into the scrutiny process on day one, and we are so grateful for that.
Yes, thank you, Chair. I mean, I agree with the comments that have been made, and in particular, there are things that we've learned as a result of this process that we need to follow through, both in terms of how we deal with the current phase of the pandemic, but also when hopefully we get back to business as usual. In particular, a lot of the work that we've done in partnership, the way in which a lot of our frontline staff have worked together, the work that we've done around supporting the more vulnerable members of our community and so on. So for me, there are a lot of lessons we can learn from this, both in terms of how we manage the challenges that we face right now and how we go on from that prospectively.
Thank you, Neil. I'll finish off the backslapping by a little bit of pride, really, because I was not surprised that all of our health partners bought in on day one and played an active part in this whole scrutiny process. And I'd like to think that really firm working partnership and relationship will continue from this day onwards. And I like to think that we've sort of had a little bit of input into that. So thank you all, thank you. And will you please pass on to every single member of staff, wherever they may be, how grateful we are to everything that's been done to facilitate this piece of work. It's been a good piece of work, and we've enjoyed it. And I just hope that we leave Dudley Borough in a better place for it. So thank you, everyone. Can I just say we've got programmed, we have a meeting for December the 8th. I think we've deserved a rest. So if everyone agrees, we'll cancel the December the 8th committee meeting because we've got one in January anyway. So whatever, as much as anything, our officers need to see their families as well. And there's more important things to do than coming to sit at just yet another ordinary meeting, having been through all the COVID stuff. So with your approval, I'll cancel the December the 8th meeting. Mo Farouk.
Yeah, sorry, Chair. I wasn't going to say anything, but now that you've raised a cancellation of the meeting, as monitoring officer, I have a role in that. So I'm agreeable to your request of members to cancel the meeting. And can I also say, as I'm on, that a Secretary of State, I think about 10 years ago, said that scrutiny was the lion that failed to roar. Well, can I say that on this occasion, this scrutiny committee, with the review of the pandemic, has definitely roared. And we had a famous Francis inquiry, which you know, relating to Stafford Hospital, which looked at the whole concept of scrutiny. And I think this is the ideal example what you've been doing over the last few months as a scrutiny committee. It's not to say that we always get it right, but certainly on this occasion, the review has been very good. And as monitoring officer, I can sleep well at night knowing that as a local authority, we might not get things right all the time, but a lot of the time we do get them right. And this is one of the best examples in many years. So I think you can rightly slap yourselves on the back, and it's a job well done. Thank you.
Thank you, Mo. And coming from you, I'll take that all day. Thank you very much. Councillor, and there was another one, but they've gone. No, that's it.
It was me, Chair, and it was just to endorse everything that you've just said there. And we'll have more information if we leave it till January for us to be able to scrutinise, because it's going to be a very hard time during December.
Right, thank you very much. And I have to say, I'm sitting here with fingers crossed because I'm hoping there's elections in May. If not, you might have it for another 12 months. So, but I don't know how things are going to pan out at the moment. So my retirement is already 12 months late. So there we go. Now, as this is the last meeting, then there won't be another one before Christmas. Can I take this opportunity to wish each and every one of you and all of the officers on Dudley Council who've supported us and our partners a very, very peaceful and a healthy Christmas. I just hope that after this Christmas, we'll get back to normality next Christmas and we can enjoy 2 Christmases in one. So thank you. Thank you very much. Now, agenda item 7 is to consider any questions from members of the chair where 2 clear days notice have been given to the monitoring officer.
None, Chair.
Thank you, Helen. That concludes the voting from the Luxembourg jury, folks. So thank you very much. Good night.
You. Bye.
Thank you, Chair. Thank you, members. Good night.
Thank you. Bye.
Good night.
Good night.
Thank you. Good night.